Yeah, Marie mentioned my name is Jeff Bethel. I'm faculty in the program. We're co-hosting the seminar today. Um, as Marie mentioned, this is a hybrid seminar. We have folks here on board, folks on Zoom. For those of you on Zoom, you're all muted. If you want to ask questions, use the Q&A feature. We'll get to those questions at the end of Dr. Scholz's talk. Dr. Ryan Scholz, you've been the state veterinarian in Oregon since November 2020. He has 4 degrees from Oregon State University, 2 bachelors in bioresource research and animal science, respectively, DDM, and I guess most recently, MPH in epidemiology. And just as a plug, our college has a formally approved dual BV and PH, but we know it's open to all options, not just epidemiology. Right. Of the vet students here, and I'm doing keep that in mind. So, as state vet, Dr. Scholz's responsibilities include preventing and tracking livestock diseases, supporting and practicing vets across the state, implementing regulations related to animal health. His work also involves close coordination with Oregon Health Authority, particularly on diseases that can be transmitted between animals and humans. Today, Dr. Scholz's presentation will provide an overview of the emergence of highly pathogenic avian influenza in livestock, and how this highlights the One Health model that recognizes the health of people is closely connected to the health of animals and our shared environment. So it will do questions at the end unless something comes up and you want to
raise your hand if you have questions.
Thank you.
I don't remember what you're asking me the question about, and you probably won't remember the question in the end, so feel free to ask questions. So good morning. Today I wanted to start with a little bit of an overview just to help kind of frame the talk. It's just kind of the One Health model from the perspective of state veterinary. We're all learning with it. A little bit about what is the position of state veterinarian. How do we, in general, control and prevent diseases in livestock? It's very different from how we do it in humans. And then we'll talk a little bit more about, and we'll spend the majority of our time talking about AI and what it's been doing. So, what else? So this is with taken to a World Health Organization. This is how they describe One Health. That it's an integrated, unifying approach that balances the health of people, animals, and ecosystems. Integrating all 3 of those together and recognizing that all of those systems are equally, closely interdependent. What happens in the environment affects humans, it affects animals. What happens in animals affects humans, it affects the environment. What happens in humans sometimes affects animals and the environment. What happens to humans tends to be less the issue than what humans do. That tends to affect those other 2, but really it's the end goal is collaboration across sectors and disciplines. That there are a lot of things that we in the animal world have a lot of expertise, a lot of experience on. We've been dealing with avian influenza for 20+ years. The human side doesn't have as much experience. And so working together and also recognizing that disease, if it comes into a human, it's coming from an animal. So what we can control in the animal prevents it in humans and vice versa. So really this is again, the World Health Organization's kind of infographic for it. I like this one. There's a lot of infographics out there, but I like this one because it really highlights, it's more than just animals, plants, and people. It's really the whole system. It's a whole system approach. And really recognize that animals, from the veterinary standpoint, animals are often settings. When we're talking about bioaccumulated toxins, animals tend to be affected before humans. When you look at disease spillovers, so that's usually spilling over from animals into humans. You see those diseases in the animals first. And then even things like bioterrorism. We often in the veterinary world learn about the diseases that are reportable in the animals, because many of them are select agents, many of them are bioterrorism agents. But they're diseases we see on a normal basis, potentially on an everyday basis. Hypatia we'll talk about, that is a select agent. For the reason why it took us almost a month to start doing research on Hypatia cattle is because it's a select agent. FBI and Homeland Security tend to frown upon doing studies with select agents on species that we thought that means about what we present in, because it's a bioterrorism case. They don't want you to figure out how to more effectively infect animals that aren't supposed to be infected. So Similarly, the environment impacts human and wild. And this picture is actually from we were down there right after the fires that happened a couple of years ago. This was the center square of the town, but we had an upgraded tour. But more frequent or severe natural disasters. Those have huge impacts on animals, have huge impacts on people, have huge impacts on diseases as well. As migratory routes of wild birds, particularly waterfowl, have changed, we've seen avian influenza spilling over differently from year to year. Those states have impact. The wildlife diseases spill over into domestic animals, especially as we have interactions happening that don't normally happen. We have a really dry summer, and now all of a sudden all the irrigation ponds look really attractive because the natural water sources are dried up. We saw that in 2022 in Deschutes County. We'll talk about that later. And then those domestic animals, whereas we don't have to worry quite as much about the disease spilling from wildlife directly to human because the interactions don't tend to be there as much. Once that spills over into domestic animals, now we have that direct constant interaction with humans, and it significantly increases the risk of that spilling over again. And once a disease has spilled over once into a non-target species, it's much easier to spill over again. We worry about that. A couple of just examples we've had just in my short tenure as state vet, and I was here for about 8.5 years before that as a district vet. But we've had a number of issues actually happened during COVID. We had a spillover. It's actually a less common spillover scenario, but we had a spillover of SARS-CoV-2, the virus that causes COVID, from a human into mink. Not very often we talk about that direction of spillover, but it does happen. We had a mink farm where in Oregon that got infected. There were mink farms all over the country. Every one of those cases we were able to trace back to the people. The people on the farm were infected and infected the animals. But that involved a huge One Health response. The human side, of course, was already busy with COVID. They tested the people as part of their normal response. We responded to the mink. It's really hard to respond to a disease like that in a farm with 50, 60,000 susceptible animals when there's no PPE around, and we donated all of our PPE 5 months before that to the human cause. So we were maybe a little overdressed. We were using our pappers and the PPE we would normally use like an anthrax case, just because we didn't have N95s. I did not have that coveralls at that point. But then we did wildlife then too. Mink are mistelid. There's lots of wild mistelids around. And so doing surveillance, doing trapping, doing monitoring around those farms to make sure we don't spill over into the wildlife and create a stable reservoir. Exact opposite of what we're normally worried about, but it works that way too. We had wildlife biologists out on that farm for 6 weeks straight, doing trapping, doing different things to ensure that no mink escaped that farm and made it into the wild. Because if they escaped that farm, the virus, they created a risk of spillover. Rabbit hemorrhagic disease is another one. That one's actually still ongoing. That was so. If you notice the timing here, so this happened 21 days after I started this position. This one was about 4 months. I had a little more time to warm up in the position. Happened a week after we finished with his farm, though. We got our first case of rabbit hemorrhagic disease. Not a zoonotic disease on this one, but a huge One Health thing nonetheless, because it was found initially in actually paired domestic rabbits in a feral rabbit colony in Milwaukee outside Portland. In late March, and it's a disease that causes rapid death in rabbits. And most legomorphs, not just rabbits, hares, and it was assumed that it could also affect pica. There's a very, very heavily threatened population, isolated population of pica on the western slope of Mount Hood. It was the western and northwestern slope of Mount Hood. And there are wild bunnies that range from the Portland area all the way up in Mount Hood. We actually had biologists on this one. So, we were dealing with the domestic side. Wildlife was trying to create that buffer so it did this disease and spill over, because once it gets in the wild population, they don't tend to die as fast. And so they carry that virus a lot longer. They're worried that they would eventually make it up there. Easter morning, 2021, we had wildlife biologists in a park in downtown Portland hunting rabbits at 6 o'clock in the morning to make sure we didn't have that buffer spillover. One press releases out about Highly Pathogenic Avian Influenza. We'll talk more about this. This has been a huge One Health thing, though, because it comes from wildlife. The reservoir is wild waterfowl. We also see it spill over within the wildlife population into raptors, They're scavenging waterfowl. It doesn't come as a huge surprise. They're birds. We know that a lot of bird species are susceptible. We've also seen it in mesocarnivores, though, in the scavenger species, the skunks, raccoons, foxes, some of the small scavenging carnivores, foxes, weasels, those kind of species. We've also seen it spill over into marine mammals. There have been die-offs in seals. There's an elephant seal found here, actually technically in Washington, one more inside the river. There's been a number of different species that spilled over it. And then, of course, the animal side, the domestic poultry, we've had 38 cases now in domestic poultry, 38 blocks, 38 outbreaks. Every one of those is from a spillover, a new spillover to waterfowl. Now we're dealing with cattle who had chicken diseases and cows on their 2024 end of the world calamity bingo card. I certainly didn't. Turns out cows in their mammary glands have both human and avian influenza receptors. Same as pigs have in their lungs. No one knew that until about 2 weeks ago. No one really had any reason to suspect. To look in the mammary tissue of cows, almost more influenza receptors. Turned out we do. And then the human house, like we've always known this is a zoonotic disease back in the early 2000s when H5N1 was emerging in Asia. We know there were a lot of spillover events that happened, usually one-off events, generally didn't resolve in human spread. Mortality rate, and that was usually over 50%. That's the last time it was really seen. So now in the textbooks, the mortality rate of that disease in humans is over 50%. Luckily, so we have had 2 cases here in the U.S. Both of them were very mild. We hope we continue that. Well, we hope we don't continue to see any cases, but we hope the cases we do see are mild. So just a little side story. This little chicken here. So we deal a lot with chickens. This little guy, again, the one health thing. I was doing an investigation into bison that were imported illegally by a taxidermist. Walking into the shop, and this chicken started crowing at me. It's a stuffed taxidermy rooster. I actually knew this rooster. I used to do the certification testing for his owner, who was a friend of the taxidermist. And I recognized the crow. This rooster's name was Ryan. Apparently, we had similar behaviors. That's how I had to meet again. They actually recorded his crow. Okay, so moving on. So to talk a little bit about what my position does and how the Department of Agriculture fits into that One Health model here in Oregon. We're a little bit unique in Oregon compared to most states. Not on this top part, but in how some of our definitions fit in. So everything we do is really, really heavily embedded in statutory authority or administrative rules. A lot of that is because we're dealing with property. And so we have very strict laws that give us a lot for it, but they also really narrowly guide us. So everything we do is based in some sort of authority. But the state veterinarian is actually one of only about a half dozen positions statewide that are statutorily provided for. There's actually a statute that provides for the office of the state veterinarian. And it provides that the state veterinarian is the chief livestock sanitary official for the state of Oregon. Our statutes have not been updated since 1955. And that was when we were combined with the Department of Agriculture. We're pretty sure they probably date back about the 20s. So there's some language in there you have to kind of interpret through that line. But federally, my position is recognized as the state animal health official for Oregon. And my position is responsible for carrying out the duties of ODA as protection of people and livestock. We have that dual role. It's both protection of livestock from diseases, and protection of people from diseases of livestock, which is where the One Health comes in. It's really statutorily, it's exercising sanitary and disease control supervision of livestock. There's all those different same charges, but it's really this one that we really focus in on when we talk about preventing infectious contagious communicable diseases to livestock and people. And a disease of livestock to people. This is how we started. This is, despite the horns and the look of this is actually a cow. It's her big cow back in about 1940, 1950. They were vaccinated for brucellosis at that time. This was actually an assistant, State Veterinarian for the Department of Agriculture. There's enough different months of the later. So why only livestock? And this is where Oregon is actually very unique among the 50 states in that most states refer to livestock in our statutes. So if you notice, all the things that I'm talking about so far have been livestock. However, we define livestock. So that term, the reason for livestock dates back to the early 1900s. So the position was created. But livestock includes, but is not limited to, horses, mules, chickens, jackasses, cattle, sheep, dogs, hogs, goats, domesticated fowls, citizen granites, domesticated for varying animals, bison, cats, poultry, and any other vertebrate in captivity. Fish are not livestock. Like, don't have to deal with fish. I'm a little bummed about that. I actually really like fish. Fish are the purview of the Department of Fish and Wildlife. Everything else, though, if it is domesticated, or not even domesticated, if it's in captivity and it has a backbone, it's considered livestock. And so in a lot of other states, livestock are really narrowly defined as like these top couple of things. And so companion animals tend to kind of float off on their own and just kind of get picked up by whoever will take it. So a lot of times people help them. But in Oregon, it falls expressly to the Department of Agriculture. So in addition to the disease stuff, we actually do a lot of other things. I have a staff of 10 people, I think, something like that we do all these things. So we're very lean. We do a lot of things. As you can see, I do a lot of things. But in addition to the disease surveillance or response that we're charged of for animals, we do a lot of traceability. So one of the ways we control diseases is knowing where livestock have moved. So when we have an outbreak, we can find who's been exposed and quickly get on top of that disease. We also do a number of disease certification programs. That's how I knew that rooster. We do a lot of surveillance and certification and certify flocks or herds of livestock as free of certain diseases to allow for interstate commerce. And then we do a lot of in that emergency and disaster response. So I'm also the state's lead for animals in disaster response. And then we do exotic animal licensing because someone at some point in the legislature decided, why not? Why shouldn't we make the state that way allows it? And then we've also licensed veterinary products, so vaccines and different pharmaceuticals and products used in animals to ensure that they're safe in the marketplace. And then I actually manage 2 other programs also, licensing animal rescues and licensing animal feedback. So when we talk about diseases in animals, we do things very differently than humans. Same concept. We just have a lot of different authorities because animals are not people. Just in case you were wondering about that, they are not, in fact, people. They are legally considered property in all 50 states of the country. And that's really important to how we control diseases because we don't have to deal with civil liberties in our patients. We don't have to deal with HIPAA. We don't have to deal with all those things that the human health world has that really limits. When I talk to my colleagues at Oregon Health Authority and we talk about quarantines, they talk about voluntary quarantines that they in theory have quarantine powers, but they would never be able to utilize them because it would get hung up in courts for so long. I issued probably 12 quarantines last week. We do it all the time. And we have never had one challenged because it's commonplace for us. So that's a huge part of our control strategy, both quarantining the individual affected farm and then with some diseases like avian influenza, quarantining areas. I can quarantine the entire state. I have statutory authority to quarantine any region of the state up to and including the entire state. And there are diseases where we do that. We would quarantine and stop all animal movement within the entire state of Oregon. I can mandate vaccination and testing. Again, think of how quick COVID would have been over if the human health world could have mandated that every person in the state be tested and vaccinated before moving. I can mandate it before leaving the farm of Oregon too. So imagine if they could have mandated before you leave your house every night, you have to test. Again, people versus animals, that pesky civil liberty thing gets in the way on the human side. We don't have that on the animal side because they are considered property. We can restrict movement, not just quarantine. We can restrict movement into the state and within the state based on requirements to test or vaccinate. And then we can also require mandatory euthanasia. And there are a lot of cases where we do that on diseases that are not treatable. Avian influenza in poultry is a good example of that. Those animals are going to die. 99.99% of those chickens are going to die, and they're going to die very quickly and die a very horrible death. And so we euthanize them before that. It's the same end, it's more humane, and it limits the amount of virus that's being poured into the environment to potentially spill over to humans or still back into wildlife populations. So again, we have a lot of a lot of authorities. You may recognize the finely dressed gentleman in the picture here, mixed in doing his internship with us this winter. So we do with some regularity have to euthanize animals usually for humane reasons. But we actually do a lot of training. This is a rubber pit. That's why they're seeing that comb overlook. It actually has a basic Play-Doh rolled inside of it that's the size of a brain. But there's a lot of things that we have the authority, very open, broad authority to require in it for not just animals infected with, but also exposed to where there may be a carrier of a disease in order to stop the spread of diseases. We can also summarily quarantine areas and limit not just a little bit of livestock, but also vehicles and people within that to the extent that they would cause spread of disease. Just because we have those authorities doesn't mean that's how we do it with every disease. It really depends on the disease and the species that it's in, and a lot of those factors of how we control diseases. So I just threw a couple of diseases up here that kind of highlight different things. Equine herpes myeloencephalopathy, it's a herpes virus infection that instead of being a respiratory virus, it mutates and affects the central nervous system and causes a ascending paralysis of animals. So we don't euthanize horses. We very rarely euthanize horses. There just aren't many diseases that require it. But in that case, the infected horses do often end up euthanized for medical reasons. But really, that one focuses on quarantine and mandatory testing and mandatory monitoring of all the exposed animals on the property. So any exposed animal, we mandate it has to have a temperature taken and reported twice a day for 28 days while under quarantine. Brucella abortus. Luckily, we don't see this one much anymore. That's really what my office was founded on, was Brucella abortus and cattle brucellosis and cattle tuberculosis, also two diseases that have largely been eradicated, to the extent that this last year we actually removed all of the mandatory programs around this disease because it just doesn't exist outside of Greater Yellowstone. But in that one, it was a lot of movement restrictions. You couldn't move cattle within the state or in between states without being vaccinated, and depending on the breed and situation, oftentimes being tested. And then if any animals were infected, it was a mandatory euthanasia of those infected animals. Back in the day, it was mandatory euthanasia of the entire herds. Nowadays, when we see it, it's a test and cull program. We remove the infected animals because it's not a treatable disease, a lifelong infection. We don't cull the entire herds anymore. In influenza, again, just to highlight the differences in them, with poultry, we do euthanize the exposed animals, quarantine the property, mandate cleaning and disinfection of the property. And if they can't clean and disinfect, so backyard flocks where they're outside, it's not cleanable facility, we actually mandate 120 days of quarantine of the properties with no poultry present, because that virus can survive in the environment for so long. In cattle, we do it different. This disease, for one, it's new, but it doesn't kill cattle. It only really affects the mammary glands. So in that disease, it's a quarantine and movement restrictions. There's pre-movement testing that's required to try and find the disease. But it's really a quarantine, and then permitting milk to go only to pasteurization. So we control the movement of that milk, raw milk to pasteurization. We wouldn't allow raw milk to leave the barn. And it's Great is another disease. This is very closely, it's transmissible spongiform encephalopathy, very close to mad cow disease or BSC or chronic wasting disease in deer or elk. Happens in sheep. It's actually a naturally occurring disease. But when we're talking cases, it's quarantine. We actually test all of the herds. This has been linked to, there's a genetic predisposition to this. And you have to be recessive. It's a recessive trait. So you have to be dual recessive in order for an animal to actually develop clinical disease. And so when we find a case, we will go and test all of the sheep in the flock for the presence of that recessive trait. We will remove any sheep that are double recessive. We will allow homozygous or heterozygous females to remain, but then we require homozygous dominant rams in the flock so that you can never end up with a homozygous recessive animal being born in its flock for, I think we do it for a minimum of 6 years to make sure that it's bred out of. Okay, So a little bit of background on avian influenza. I'm going to move through the poultry stuff fairly quickly. It just gives kind of some background on where we're coming from. But typically, historically, it affects chickens, turkeys, quail, and then waterfowl, which are really the reservoir. But even domestic waterfowl, they get infected and they don't really show symptoms. That's part of the problem you see. And then migratory shorebirds can also carry it. So avian influenza is we define just practically in two categories of either highly pathogenic or low pathogenicity. It literally is just how many, even do the birds die or do they get sick when it gets into gallinaceous species. It used to be that the way they tested for this was literally infecting 100 chickens and figure out count how many of them died. We have better methods than that now. They found the genetics of it. The high pathogenicity is only associated with H5 and H7 hemagglutinin strains. All of the rest of the H's, there's like 168 combinations of hemagglutinin and neuraminidase strains of avian influenza virus that can potentially infect wild waterfowl. Only the H5 and H7s have ever been shown to become highly pathogenic. That trait, that gene that allows it to become pathogenic, is tied to those two hemoglobins. So those are the only two we really control. Most of them show very few signs, if any, and most pose zero threat. They're out there in the environment all the time. When we do wild waterfowl surveillance, we find all sorts of different virus strains out there. And none of them pose any food safety based on how food is produced here in America. So the lineage is really important in these two because North American strains that we normally have here, we have H5 and H7 North American strains. They always circulate in the wild as low-path viruses. When they spill over into gallinaceous birds, the rapid generation cycle in gallinaceous poultry, large flock, causes mutations. At least, the more that they replicate, the more they mutate, and they can convert into high-path AI. So we do control these still, but they're not the North American strains. We don't worry about circulating as high-path. There are the Eurasian strains are the ones that circulate in the wild as high-path. These initially emerged in eastern China back in the early 2000s. We've seen them spread globally. We previously had an introduction in 2014, late 2014. Oregon actually had the first case in that hassle outbreak, 2014 or 2015, down in Douglastown. Those are the ones that actually circulate in the wild as high-path strains. That 2014-2015 strain got outcompeted and burned out of the waterfowl by that summer. That's what other introductions have typically done. This strain that was introduced in 2022 didn't. We've now seen recombination or assortment where that high path gene from the Eurasian strains has now been crossed over into North American viruses. And we're now seeing North American origin H5 viruses that are circulating in the wild with the high path gene present. I do not think we are ever going to see this virus not in our waterfowl populations anymore. This virus is, for all intents and purposes, endemic in North America, as well as South America and Africa and Europe and Asia. They see it a little bit in Oceania, but not as much, just because the migration hasn't happened. Antarctica is the only continent that hasn't seen it yet, and they actually think they probably have. It's a lot harder to sample in Antarctica. So it's spread generally through direct contact. So this is kind of the scenario that we normally see. Wild ducks land on the pond with domestic ducks. They pass that virus over. These domestic ducks then carry that virus and shed it for up to 3 to 4 months without showing any signs. They then come back to the barn, eat with the chickens, and all the chickens drop over. We also see it through indirect contact. Our 2 commercial cases we have this year, both of those, one we know happened by just someone stepping in the front door of that barn with goose feces on their feet from just walking through the farm. Stepped in to turn on the fans. The switches were right inside the door. Stepped back out, and we watched that virus over the next week start at that doorway and move its way through that barn. So it does not take very much of this virus to get in. We have also seen cases from scavenging. Oregon actually saw the first case of the H5N1 virus in the Western Hemisphere in a domestic cat. We had 3 domestic cats die that were associated with one of our poultry cases. They tested positive. What we ended up finding was that wasn't even scavenging. That was they lived in the chicken coop. And so moving through the litter of that coop and then grooming them, so they were ingesting it. We see lots of wild carnivores now dying from this, as well as other reasons. So this all started in Oregon. So we first saw cases down in the southeast in early winter in February, first case in 2022. Our first case was May 6th, 2022, just in the tangent area. About 100 free-ranging birds, just about a little bit of every species possible. These are classified as non-poultry by the World Organization of Animal Health. That has nothing to do with the species. It has to do with the use. So the World Organization for Animal Health dictates how we have to respond to these internationally reportable diseases. And they say in poultry, which you have to do the regional quarantines, there's a whole lot of steps you have to do. But they define poultry as poultry species that are produced for an economic benefit. You are selling a product from those birds, then they're considered poultry. If you're not, if they're pets, they're considered non-poultry. We don't have to report them internationally. Poultry, HPAI and poultry has to be reported within 24 hours. In non-poultry, it's a 6-month aggregate. And there's fewer controls. So we did not have to issue a regional quarantine on this one. This was just a surveillance area, which we do surveillance, passive surveillance. Actually, this one we did. We moved to passive surveillance after this one. But there were no movement restrictions. So then about 2 weeks later, we diagnosed it just north of Eugene, up in this Hoburg area. 450 pasture-raised ducks and chickens. Again, chickens were dying like crazy. Ducks were perfectly fine. By the time we got confirmation, made it out there, there was almost no chickens left. All of the ducks were running around just fine. My vets that went out there told me they were doing just fine when they had to catch the cotton. But they were classified as poultry because they were being produced for meat production. And this one did result in a regional quarantine. We're a little bit unique. Most states are able to just draw a 10-kilometer circle around, like we saw in that first picture, and quarantine that. Because we have of our statutory authorities and the way they're written, I have to legally describe the quarantine in an order, the boundaries of the quarantine. So this one, you can see they follow roads, rivers, county lines. So this is actually a lot more than 10-kilometer zone. Now we use sections. We use township range sections. They're striping them now because it's just a little bit easier. Because I have to publish an emergency rule in that area. So for a period on this one, it was about 4 weeks, no poultry to move within that area as a control. We've gotten that dialed in a lot better since. So normally what should have happened, what we've seen happen with North American strains in the past, when we see the domestic poultry, is all cases nationwide generally end by June 15th. Prior to the summer of 2022, there had never been a case of avian influenza diagnosed of an H5 or an H7 strain of avian influenza diagnosed in domestic poultry in the U.S. after June 15th, between June 15th and September 15th. Never happened. Part of that's because of waterfowl biology. Part of it is just viral biology and how the dynamics of how it transmits, and the fact that it's sunny, it's dry. Influenza viruses don't like sunny and dry. They like cool and wet. And so generally we don't see that past June 15th. Waterfowl, they will settle in their nesting sites, raise their young. They don't tend to move much until those young fledgling can fly. So that limited movement also creates limited opportunities for interacting with domestic birds. And then historically, when we've seen Eurasian strains of virus inter waterways, the North American low-pass strains generally outcompete them over the summer on the summer nesting grounds. You'll see them burn out by the next year because there's so many of those viruses circulating, they just outcompete. And those strains are generally better adapted to North American birds. But here's what actually happened. We had 2 cases in May, 1 in June. We thought we were doing great. And then July rolled over. 6 of those 8 cases were in Deschutes County. Deschutes County is not known for being wet or cool in July. And it certainly wasn't. It was bone dry. Remember, 2022 was a huge drought year. It was also average temperatures were hovering around 100 every day or above. That's that month in that county. But what had happened is it dried so much, there were very few natural water bodies of water for the ducks to nest in. So they found all the irrigation ponds. They landed on the irrigation ponds. Well, what happens in rural Deschutes County, those irrigation ponds, people will see the ducks land on and they fly off. And they think, oh, that's really cool to have ducks back there. Here you should get some ducks. So they get a couple of their own ducks, right? And then the ducks have babies. And then they start, they're getting the eggs and thinking, well, now that the ducks have babies, I don't want to like keep stealing their eggs. I really want my own eggs. So maybe I'll get some chickens. Then they get some chickens. And now they have just a menagerie of all sorts of avian species running around their farm. And then a pair of wild ducks lands on their pond, intermixes with their domestic ducks, and then the domestic ducks come back up to the farm, the barn, they eat with the chickens, and in fact, pass the virus to the chickens. That's what we were seeing. Normally, we don't see ducks spend time on those irrigation ponds. They're hard to get into. They're competing with domestic poultry, but there were no other choices this summer. The two other cases we had were very similar cases. It was cases where wild waterfowl were kind of forced into residential areas or farm ponds because there was no other option out there in a lot of areas, or the available environment was a lot less. We continued to see those wildlife detections. So this presents a really interesting issue that we had never thought of. We've been preparing for high-path AI for 20 plus years. We knew it was coming. We were preparing for it between about mid-October to mid-April. In the middle of the winter, you could throw an extra sweatshirt on, grab a pair of Tyvek that's one size bigger than you're used to, and go spend the day in an N95 Tyvek working hard. And it's 100 plus degrees out. I can't allow my employees to do that by law. But we still have to do this. We were actually exempt from the heat standards because it was an emergency response, but we were having to send double teams out. Normally we send 2 people with 1 person on the outside. We had to send 4 people, 2 people on the outside, and swap every 15 minutes because we couldn't be in that PPE. If you were in that PPE for more than about 15 minutes, you couldn't. You just couldn't survive it. And so it created a really difficult response. You may remember I mentioned I have about 8 to 10 employees, and several of those work in other programs. And we've got 3 USDA employees here in the state who were able to help us. So it wasn't all hands on deck day all summer long. That leads to burnout. So, we since that time, we've had a total of 38 cases, but a little over 750,000 birds. I think we're actually up to about 860,000 that have been affected. The vast majority of those were from these 2 commercial flocks that happened this last November. But you can see kind of a spattering of throughout the whole state. Generally, where you see waterfowl migrating through, and where you see people, we've had cases. That is the gray circles are cases that have been resolved. Those are when we have active cases. They show us yellow for non-poultry or red for poultry flocks. But we've had cases just about everywhere. Nationally, it looks pretty similar. There are only 2 states that have not. That should be 48 states. Sorry, I updated an old slide. Hawaii, which kind of makes sense. That's a really long ways for a duck to fly. And Louisiana, which Louisiana doesn't have a state veterinarian. It's a political appointed office. So they don't have anyone to test. So if you don't test, you never get in trouble for having a disease. So nationally, we're up to almost 91 million birds that have been affected by this virus in 2 years. So it's been a big deal. This is the other thing that's really concerning with this virus. You'll notice we have several zoonotic in our state. These are all different species of mammals that have been affected. And there's some you wouldn't think of, bottle dolphins, gray seals, harbor seals. Marine mammals are known to be scavengers, and they will scavenge waterfowl. And particularly the migratory seabirds, as all of these are scavenging mammals. And so when you have waterfowl get affected by this, the ducks don't generally get affected, but the geese do. We'll see neurologic geese, especially the young of the year will be neurologic. They'll be slower. A lot of times they will recover a lot of the opportunity. These guys don't tend to allow them the opportunity. But the ones they're killing and eating are generally the ones that are affected. Yeah.
You see neurologic signs and like Scobies, I guess, which are kind of in between.
We will, yeah. Muscovies, I don't really count as a duck in there. So for those who aren't familiar, Muscovies they're an Asian breed of duck that are just up there. I don't know how to describe them. They don't look like they should be able to survive on their own. They're kind of the English bulldog or the Shar-Pei of the ducks. The duck species. So yeah, we will see neurodogs. In most of these mammals, that's what we see also. So we have two really unique cases. This one up here was a skunk. That was the first documented case of a mammal. So normally these are considered to be dead-end infections. First documented case of a mammal spillover back to poultry. They had a couple of skunks they found dead under their chicken coop. And then a couple of days later, the chickens started dying. They're right up on the Columbia Slough. We think that the skunks were probably scavenging across the road of the slough. Their chickens were enclosed. They had no outdoor access. But those skunks died there. And then we also had the cats that happened later. That was the first documented case of the virus in domestic cats in the Western Hemisphere. So this disease leads to a lot of One Health collaboration. We're responsible for the animal side. The animal side is the majority of the response. Wildlife, it's kind of there. But our official wildlife here at the state level does a lot of wildlife surveillance. They do a lot of response when they have die-offs, especially with the Canadian geese in the fall when they fly through, or when mammals are affected. The mammals pose a little bit of a problem though, because we also see those mammals affected with rabies from time to time. So they have to kind of take some cautions there. They basically just kind of duplicate that surveillance now. So we do the poultry disease. We also do a lot of human side, a lot of human prevention also. When we go out on an initial call, so when someone calls our hotline and says, hey, I've got chickens that are dying, when we send a vet out, they respond out there and they bring not just PPE for themselves, we bring a tin PPE for those owners. Because those owners are going to keep caring for those birds for the next day or 2 days while we're waiting for results. We know this is a zoonotic disease. We don't want to give it a chance to make this a public health risk. So we do bring PPE. In the dairy side, we will provide those producers with PPE for the full duration of the infection. OSU, the Veterinary Diagnostic Lab here at OSU, does the diagnostic testing. They do the diagnostic testing for ODFW as well on the wildlife side. And then when we respond to a confirmed case, we often take wildlife biologists with us. Free-ranging ducks that are not actually sick, but really hard to catch. These guys have some other tools in their toolbox that we don't have. But then we also provide an immediate and automatic notification to our health authority, which they will then work with the local public health agency to notify them to do monitoring of those owners. And then they also do monitoring of all of our response and like symptoms for 10 days after the exposure. And so that automated messaging, that's something we came up with early in this outbreak just because there were so many of these. And they've actually published a couple papers on how that's gone just because it's been so unique around the country in that collaboration of just kind of that automatic reporting that they don't have to call us, they don't have to watch anything, they get emailed out of those people listed on it, and they're able to just initiate it from there. They don't have to come out on the farm with us because we're bringing resources from them to the owners. The other big thing that's not up here is, as you can imagine, this is a stressful event. Anytime we're responding to one of these diseases, especially something like hepatitis, often we're doing it with euthanasia as the tool. And that's not pleasant for owners. That's a really difficult conversation. And it can go, we've had cases because we do have a rapid on-site test we can do. We've had cases where it's gone from, we get the call at 5 o'clock Friday night, we show up at 7 o'clock and we leave there with all of their birds in a bag by 8 o'clock. It can go really, really fast. And so we do provide mental health resources here. That's actually something we partnered with the College of Health. And your extension folks, I'm doing that with the agri-stress hotline. Before that, though, we were providing a lot of the county resources that they were compiling for us to provide that, as well as critical incident debriefing for our responders. We've got 38 of these responses. The least that any of my employees have been on, other than Nick, because we've only had one case while he's here. Yeah. And he didn't even get to join on that one. The least any of my responders have done is at least 20. It's stressful. We're used to the euthanasia side of it. That's what we do. We go into this field of work knowing that's what we're going to do. But we are the only point of contact with the owners too. And I can tell you from my personal experience, I became a vet because I'm not a huge fan of people. And then my wife will tell you that I went into public health because I got through vet school and realized I'm not a huge fan. So that's what we So we do a lot of critical incident debriefing with our own responders as well. And then there were the cows. I didn't put any slides here on this because even if I put in a slide yesterday when I was finalizing this, it would have changed already based on the conference call that was happening when I was coming down here. So in early February in Texas, we started seeing a weird syndrome happen. No one can figure out what it was, on feed or something. It was only affecting a small subset of cows on the dairies. It was resulting in reduced feed intake, reduced milk output, and changes in the consistency of the milk. Late March, they found H5N1 type influenza in bone samples from a couple of those farms. Fast forward to today, I think we're up to 42 cases in the United States now. There has been some sampling done by FDA. The retail milk samples, it sampled 291 samples, found viral fragments. So viral RNA by PCR, some active virus with viral fragments were found in 20% of those samples from, I think, 39 states. So that indicates there's probably more than 44 herds. We don't really know how much though, because we don't know what those samples were. And there's a lot of milk that moves. Milk may leave one dairy and get split and go to 8 different processors at 5 different states. And so and it may go, to these 3 on this day and this one on the next day. And so there's a lot of movement around and there's a lot of mixing. So that doesn't imply that 20% of dairy herds or 20% of cows are affected. But we know there's a lot of cows affected. There has been at least one human case associated with this too. We don't unfortunately know a lot about that case, partly because it happened in Texas. And they don't quarantine things. This is not a reportable disease for them. It's only a reportable disease in poultry. That farm was also never tested. We know that the individual who was affected worked on a dairy. That case, though, was essentially mild conjunctivitis. That was the only symptoms they saw. And he was PCR positive on testing for this virus. What we have since learned just in the last week or so from the genomics on the whole genome sequencing of all this, all of these cases trace back to one single spillover event, likely in Texas Panhandle, likely early December. That big gap from early December to the middle of March when we started finding out about it. That there's a lot we don't know about. We do know that human case, that strain, the virus that human case had, likely was originating from that original spillover in a cow, but it diverged before the first case we diagnosed. So we've got another arm of this outbreak out there that we haven't seen any samples test positive for other than human. So we know there's other cases that happened out there, whether they went anywhere or not, we don't know. We're still learning a lot about this, like the fact that we learned last Friday that cow udders have human and avian receptors. Just the mammary tissue of cows is capable of being infected by avian strains, human strains, and swine strains of influenza. And milk happens to be a really, really good media for this virus to survive in. And so we can, it's right up there with most of the viral transport mediums we have. So we're starting to find. And so the current thought process, the current thought process is it's likely a disease of mechanical transmission, likely milk passing in the milk parallel to milk. There was just some preliminary data out this morning actually that showed that you get about 3 logs less viral reduction over 3 hours in milk than you do in PDS on the rubber liners of those milk machines. So, a 3 hour survival time on that rubber liner when you're milking a cow on that machine every 5 minutes is a problem. So that's where we think this is likely primarily coming from. Seems like there may be a really short viremic event at the very beginning that we may have some respiratory shedding as well. But that's not well understood because that's really early in the clinical syndrome. By the time we find out about these cases, and we're seeing changes in the milk, they're usually past that. But the epidemiology on farm, the number of cows that are infected by that point, doesn't match with contagious mastitis that we normally see. So we think they're likely it's a respiratory shedding. We just don't know. And they still have not been able to get the waivers in place to do cow infection studies because it's a select agent. They're still working on those waivers. Even just to be able to do pasteurization studies, the highest biosecurity dairy research facility in the country had pasteurizer as a BSL-2 lab. Select agent has to be done in a BSL-3 lab. So they literally had to find a university that had a BSL-3 lab, enough space for a pasteurizer. FDA went out and bought a pasteurizer, small scale pasteurizer, and had to install it in that lab, knowing that pasteurizer can now never leave that lab because nothing comes out of a BSL-3 lab without being incinerated. Really hard to incinerate giant hunk of metal. And so it took almost a month just to be able to pasteurize, to infect, to put a known quantity of virus in the milk and pasteurize it to prove that pasteurization was sufficient. And the question here
Real quick. So since we've just found out that we can have co-infection of human, swine, and now the avian, should we be including in our testing recommendations testing for human and swine strains as well as to look for mixing events?
Yeah, so that's an interesting point. So the testing that we do is an influenza A matrix protein to start with. And so they're susceptible to influenza A strains from avian, swine, and human. So that's the nice thing about the testing that OSU does is it's a matrix protein test. So any influenza A will test positive initially, and then they further will differentiate if they have a matrix positive. They can further differentiate based on. I think, Christian, you guys just do the human
5, and then we go down.
Yeah, so you have the specific ones, and the National Veterinary Services Lab can do all of the full subtyping and the whole.
What's the likelihood that a human could pick up this influenza by consuming raw milk?
We don't know. So far, most of these cases have been associated with larger dairies. So we don't know if it's even happened in a raw milk dairy yet. We know that prior to cows, most or potentially even all of the mammalian cases were through ingestion. Ingestion of infected carcass of infected poultry. Those invariably almost always result in a fatal neurologic infection. I don't have any reason to think it wouldn't be possible. We'll put it that way. Oregon Health, we've been working with Oregon Health Authority, I think just yesterday, they put out an advisory. It's just as much of a risk as, salmonella, or E. coli, Klebsiella, any of those diseases. And so we've been working with them also advisors that, it's a risky application. We've been working with the OSU lab in our office to develop a testing program that we will pay for all the costs associated with it to allow producers to test their milk. So if you have someone who is doing kind of small scale farms that run milk, they can test those animals and at least have some semblance of knowledge of what what's happening or not. But there's no reason to think it wouldn't be a risk. We know humans can't be infected. We know oral ingestion is a great route to get stuff into the body. So.
Questions?
Other than changes in milk output and consistency, what other signs are you seeing with dairy cows?
Yeah, so it's really the milk output and the and reduced feed intake, and then milk consistency. It ends up looking almost like colostrum. And then there is some intermittent reports of constipation. I think likely just because they're really off-feeding, they're really shutting down. And a few of those Texas dairies, they have monitoring of those cows, and we'll get monitor for them. Illustration and just it should be second.
Doesn't an infected cow ever clear the disease, or is it just forever?
Well, that's a really good question. Unfortunately, we've only known about infected cows for about a month and a half. It looks like probably. And so a lot of those early cows were on dairies that want to not have we do have a couple of dairies that have agreed to it's in their space to do serial testing. And it does appear none of them have finished yet because they've all been in cases less than 30 days. But it does appear, watching the trends, that by 30 days it's likely done. So yeah, it doesn't seem like it's a lifelong direction. It does seem like we're seeing, even in bulk tank samples, what farm we not monitoring, they are seeing a pretty precipitous, drop with it looking like it's going to cross the threshold by certain days. We hope we have better news to share here in the next week or two on that. But
Question? Are there any plans to test any other bovids, or are they not really worried due to like smaller population and no pasteurization machinery?
yeah, so the focus right now is on dairy cattle, on dairies of any size. So it doesn't matter if it's only milking one cow. And there is a federal order requiring testing premiums, black-bird cattle, lacting dairy cattle. There's not really any plans to test other breeds of cattle, mainly because it seems to be a disease that, while there may be some limited respiratory shedding, it seems to really be reliant on that physical transmission in milking parlor. And there just aren't a lot of people that are dumb enough to try and hook the cow up to a milking machine. And so it's really focused on that. Just because we're not seeing any other evidence. We do know, though, that 2 weeks before this diagnosis, there was a herd of goats in Minnesota that were infected. They were infected by drinking water out of kiddie pool that had infected ducks swimming. So again, that oral ingestion, and that one was a little fatal. We know that they can. Again, physiologically, like our other question, there's nothing physiologically about a beef cow any different than a dairy cow that would make you think couldn't be infected. It's just that physical, again, that man-made intervention that's really neat.
I noted that you mentioned that it's a unique collaboration with Oregon Health Authority. How do you feel like, since you do have an MPH, now like people, do you think that benefits you?
I have progressed to trying to not kill them.
Do you think it helps you in your work to have the MPH, and then with that collaboration with Oregon Health Authority? Like, can you speak to that?
I do. So I think, for one, it helps me think similarly to how they're thinking, or at least understand how that means. Because you look at Oregon Health Authority and the MITE program, I'm embedded as a little tiny program inside a giant agency that has a whole lot of other focuses. Whereas that's an agency that's very singularly focused on, it's a pretty broad topic for one topic. And so there's just a lot of people there to get through. I do think it helps. I think it also helps just in my portion of the job, with that understanding that it's not just about the animals. Because at the end of the day, even if I don't like other people, I am a people. I am probably exposed to this virus more so than anyone else in this state. And we're already seeing it jump from chickens to skunks, from chickens to cats, from chickens to cows. Yeah. Those are all a whole lot closer to a human than a chicken is. And so I don't want jumping to people because I don't want to jump into meat. And so I do think having that human understanding, the epidemiology, when I look at colleagues that went through veterinary only MPH programs, I think there is a unique perspective that's gained there. That it's not just about managing the disease of the animals. It really is about managing the disease in the animals so that you cut the arrow off between the cow and the person. But it is my responsibility to stop that arrow before it leaves the cow. I'm like, yeah.
I'm a 4-H staff. What is your current album? This summer's fairest little one. And I won't hold you.
It's not looking like we're going to have any species that are prohibited. Well, to the rest of you in the room, the last couple of years have been a rough year between me and child sayers. We had rabbits and vultures and parrots for various seasons. I don't anticipate any of that. I do think there's probably going to be some restrictions on cohabitation of different species and potentially some testing that's done for surveillance. But it's not likely that we see. This is something we're going to have to live with. We're going to have to find ways to live with it, and to do that in a manner that is respectful of the risk. We can't solve the risk that's there, but we need to at least understand it take the precautions that we can to minimize the risk. Likely more to come on that in the next couple of weeks.
Please join me in thanking